Hello, my name is Marty Martin, and I work at Aequus Wealth Management Resources in the city of Chicago. Why I'm here today is to talk with you a little bit about something that you may have been wondering about over the past couple of months or couple of years. And what is that? It's really about health reform. And let's kind of go back in time and kind of trace the origins of what's known as the Patient Protection and Affordable Care Act, or PPACA, which is quite a mouthful. So if you remember, when President Barack Obama came into office, around March of 2010, the legislation was passed. And people shortened it to the Affordable Care Act and even shortened it further to Obamacare. But it was passed, but with a lot of controversy. And then what happened was we waited for about 2 years to find out, what's the United States Supreme Court going to do? Are they going to declare it completely unconstitutional or just the individual mandate? And then we found out in June of 2012 that with a 5-4 decision, the United States Supreme Court said, you know what? It's largely constitutional. Then people began to pause and said, well, let's wait. And let's wait until the election. So let's wait to find out whether President Barack Obama gets back into office or whether Governor Romney gets into office. And as you know, President Barack Obama is back in office for his second term. So now it looks as if the dust has settled. Now, whether you like health reform or not is really not the focal point for today. The focal point is to point out those key provisions that impact you. And I'm going to organize what we're going to focus on today really in 4 sections. The first section is to focus on those provisions that apply to all. Second, those provisions that apply to those under the age of 26. Third, those that are Medicare eligible. And lastly and briefly, we'll talk a little bit about the tax implications. So let's dive in for the first one. What are those provisions that apply to all? First, what insurance companies cannot do anymore is what they call rescind your coverage. Now, what they used to do is you would file a claim, and then you'd get a letter, and a letter would say, sorry, not covered. So now they can no longer do that unless you have materially misrepresented something, which is a fancy way of saying is you lied on a form. So if you do that, then they can rescind coverage. But they can't rescind coverage because you actually use the insurance that you've been paying for your premiums. So that benefits all. The other thing that the insurance companies have to do now is they can no longer set lifetime dollar benefits, whereas in the past they could. Let me use this as an example for you. Let's say, for an example, insurance companies said, you know what, you're limited to $5 million in coverage over your life. So let's say, unfortunately, you're diagnosed with diabetes at the age of 46. You're probably going to spend quite a bit of money. But let's say you've been diagnosed at 46, you're now 65, and you've spent $5,100,000. Under the old laws, what would have happened is you would have run out of money from the insurance company. But with the Affordable Care Act, you're still covered because there is no lifetime dollar limit. The other thing that the Affordable Care Act has done that applies to all is if you have to haggle, if you will, or negotiate with your health insurance company over premiums or payments, then now they have an appeal process that's a lot easier to navigate. It's still going to be a little bit complex, a little bit tough, but a lot more rigorous for you and a lot more friendly for you to be able to navigate that. So that's a good sign. Another aspect that applies to all is that more and more the health law is really focusing on making sure that you access preventive care, because it's very clear that the more you access preventive care, you prevent things from occurring, which is good for your health. It also reduces the worry of your loved ones, and in many cases, it can save you money. Another aspect that applies to all is something that's going to happen with your W-2 form. And typically, you get your W-2 form when you're filing your taxes. Your accountant may ask for it, or H&R Block. Now, what you're going to note on this W-2 form is there are going to be separate boxes now, new boxes. And on those new boxes, it's going to have an item for the employer contribution for your health insurance and your contribution for health insurance. There's nothing that you can necessarily do about that, but when you see this in 2013, then don't be surprised. Now let's focus on the second section. Those provisions that apply to those under the age of 26. First one is for all children under the age of 19, they're now eligible to have health insurance even if they have what's called a pre-existing condition. So this will be removed. So that really does provide access to children and young adults under the age of 19 that desperately need care. The other provision is for all children and young adults up to the age of 26, they can still remain on their parents' health insurance plan. So if you sum up those two, it provides greater access for children and young adults. Let's look at the third major category. So for those that are Medicare eligible, there are a number of key provisions. One key provision relates to being able to access preventive care in what's called annual wellness visits, and also developing a personalized health plan. And I would strongly encourage you to take full utilization of those particular benefits. Another benefit that's a bit complex that we're going to slow down and talk a bit about is about the donut hole. So first let me explain what the donut hole is, because it's kind of a strange terminology for health reform. But what the donut hole is this, that if you get prescription privileges under your Medicare plan, then what happens is there's a period of time where the plan is paying 100%. And then what happens is you kind of drop into this donut hole. So when you've dropped into that donut hole, then you have to pay out of pocket. And then time elapses, and then you come out of the donut hole, and then the plan picks it up again. So that's what they mean by the donut hole. So what's going to happen progressively over time, and it began in 2010 with a $250 rebate check to help partially close the donut hole, but it will continue through 2019, is that donut hole will gradually disappear. So that's good news, because you'll really have coverage throughout rather than coverage for a time, you drop in, and then you got to pick it up, and then coverage again when you go this way. So that's a benefit for many Medicare eligible individuals. Now let's focus on not so much the young adults, nor seniors, nor everybody, but a bit about taxes. So as it relates to taxes, there are two key provisions which apply to these two groups of people. So if you make over $200,000 a year as an individual, $200,000 a year, or if you file jointly and together you make over $250,000, then you will be assessed a Medicare tax of 0.9%, so a 0.9% increase Medicare payroll tax above and beyond what you're paying right now. But if you make less than $200,000 as an individual or less than $250,000 as a couple, don't worry about it. Okay. The other piece too is that if you have net investment income, then what will happen is there'll be a 3.8% Medicare tax on that, but again, only if those income requirements are met. Now there are some exceptions to that. One exception is municipal bond interest is not included in that, and also qualified compensation is not included in that. Those are some exceptions. So with some of those tax provisions, I would highly encourage you to consult with your CPA, your enrolled agent, or a tax advisor who can really provide you with some tailored advice with regard to the tax implications. So let's kind of review what we've talked about today. So the major focal point of this particular discussion, Health Reform in You, is to acquaint you with some of the key provisions within the law that will impact you financially. But it's not just about your financial health, it's about your physical health and your psychological health. So I'd like to leave you with this, that as you begin to think about health reform in you, please use this as an opportunity to fully leverage your health and take advantage of preventive care services. And I'd also encourage you to visit our website, and then you can download this presentation and also look at some of the services that we provide. Thank you so much, and enjoy your day or evening.